Which of the following symptoms is active in clients with TB? Weight loss. Which of the following to be done for a patient showing saturation of 88% and normal respiratory pattern? Check BP. Hypotension causes the decreased peripheral circulation and shows false reading in saturation monitor. Which of the following food can be given for a patient immediately after a bronchoscopy? Never feed the patient before the return of gag reflex. Drugs that suppresses cough are known as antitussive.
What is the term for a device used to take the place of a missing body part? Prosthesis. When a client has left-sided weakness, what part of the sweater is put on first? Left sleeve. Exercises that move each muscle and joint are called
range of motion.
The Heimlich maneuver, abdominal thrust, is used for a client who has a blocked airway. To best communicate with a client who is totally deaf, the nurse aide should write out information. The nurse aide is asked by a confused client what day it is. The nurse aide should point to the date on a calendar and say the date. To avoid pulling the catheter when turning a male client, the catheter tube must be taped to the client's upper thigh. How many tips does a quad cane base have? 4. When transferring a client, most of the client's weight should be supported by the nurse aides. Legs. To be sure that a client's weight is measured accurately, the client should be weighed at the same time of day. The substance involved in inflammatory reactions is histamine.